Good morning, good morning, good morning, good morning. Welcome, welcome, welcome. Let me get the camera up here. Good morning, welcome. All right, it is time to kick off our Open enrollment 9, open enrollment 9, 2020. Let me get comfortable. We're going to be here all day today and in 1 hour increments to kick off open enrollment 2022, open enrollment 9, the Affordable Care Act, healthcare.gov, whatever you call it. Today is the day, November 1st, it kicks off. We'll be rolling to January 15th. Look, I'm excited to join you today. My name is Michael Miner, and I am the Executive Director of Oak Hill Regional Community Development Corporation and the Executive Director of Get Covered Mississippi. We are a statewide coalition that is helping folks all across the state to enroll in the Affordable Care Act. We also greet you today on behalf of our project director, Lottie Miner, and the chair of our board, Jennifer Garrett, and all of our navigators across over 50 navigators across the state of Mississippi. All right, look, we're going to join you today at 9 right now. We'll be back at noon, and we'll hear from another set of our navigators at 3, and then we'll close it out at 6 p.m. We're also restreaming, so we also want to take an opportunity to say a shout out to all of those folks who are watching us. Yes, who are watching us on Facebook, watching us on YouTube on this morning. We're just glad that you were able to join us and to be a part of this great kickoff. All right, making things happening. It's all ready to go. We hope you're excited as we are to get things going here in the state of Mississippi. It is time to get covered, Mississippi. We are open for business. Let me say it again. We are open for business. We are ready to assist you in enrolling in the Affordable Care Act. You can get started today. Yes, it is time. It is time to get rolling and to get started. Today is the day. November 1st. All right, the Affordable Care Act. It is time to kick things off. Healthcare.gov to go out and to get yourself enrolled, to find out information. You can also call us. We can assist you, 662-298-3584. Or if you want to go directly on the healthcare.gov, you can dial 1-800-318-2596. We are open for business. We are open for business. This is open enrollment 9 for the Affordable Care Act, our kickoff telethon. We will be with you today at 9, noon, 3, and 6 p.m. to share the excitement about this great time, this great opportunity for folks to sign up for the Affordable Care Act. All right, we're just waiting a couple of minutes. We have already have some questions that have come across that we're going to answer. We're going to be able to go through and make those, to share those questions and those answers with you today. We are excited about what we're going to do during this enrollment period. Now, we know in the past, the enrollment period had ended on December 15th, but it will continue this year until January the 15th. So I want to make sure that you would know that we have an extended time now. It's extended time. Instead of ending on December 15th, it will end on January the 15th. But don't wait. You go ahead and get things going so you can get enrolled now. All right. Well, look, we're going to get to your questions. Those that are on social media, we're going to do our best to check the chat. If we miss some of the questions in this segment, when we come back on at noon with Mid-South Churches, we'll be able to go through and answer them then. But look, we want you to put the questions out. We want to be able to answer your questions. All right, so look, let's talk about how it's going to go today. So let me shift over to the side. All right. Which side am I going? Yes, let me shift this way. Let me shift a little bit over here. All right. All right. So now we're starting with our headquarters team on 9 o'clock, and we're going to get things kicked off. At noon, we hear from Mid-South Churches Cooperative Conference Baptist State Convention. They'll be broadcasting from their headquarters there in Hernando. They'll be doing things to get the faith community all excited, and look for them sharing at noon. At 3 o'clock, we'll go to different areas, different parts of our coverage area. We'll be down the Gulf Coast, the Golden Triangle, the Delta, and other areas at 3 o'clock to let you know what's happening there. Then we'll close it out at 6 p.m. with our Head Start team. They began with us as assisters working with our Healthy Kids Mississippi, connecting kids to coverage with the Medicaid and the Children's Health Insurance Program. And they've now also added on, and they are excited about doing their navigator work as well. All right, okay, I guess we're going to do some shout outs. I don't mind doing some shout outs this morning. All right, good morning, Joyce Nunn from GA Carmichael. Okay, all right, thank you for joining us on today. We don't mind doing some shout outs on today, because we're going to be sharing, and we're going to be learning. Wow, I'm getting text messages as well. Okay, all right, look, I'm glad we decided to do this in different sections. We're going to have a number of questions, okay, that we're going to respond to today. So that's a good thing. That's a good thing. All right, and so what we're going to do is we're going to go through, we talked about how the set's going to be, things that we're going to do and to make things happen and make things work on today. All right, first of all, what are we talking about? That's the big thing. And why am I, okay, get to my camera. Okay, so what are we talking about? Okay, so this open enrollment, don't confuse it with Medicare open enrollment, that started on October 15th. This is for the Affordable Care Act. Some people call it Obamacare. All right. And this is an opportunity for folks who don't have coverage, you know, through their job, whatever the case may be, to apply through healthcare.gov and to obtain insurance. Now, this is not federal insurance, government insurance. You actually have a policy through a private insurer. You have a policy through a private insurer, which is just a government-based exchange where you bring in together, put in your information, and you have an opportunity to choose the coverage that works for you. All right. And we're excited this year that Mississippi has 3 different insurance companies that will be offering coverage this year. I know one year we only had 1. Last year there were 2. This year we have 3. 3 companies, Ambetta, Molina, and Cigna. All right. Now, look, we're not brokers. Get Covered Mississippi. We're navigators. Also part of our network are the certified application counselors through the Community Health Center Association of Mississippi. We are not paid by insurance companies. We are government funded. We're here to assist you at no cost. But when you go into this exchange, after you put in your information, your income information, your household information, and you come up with your analysis of the information you put in, okay? The analysis, right? And based on that analysis, it's going to determine whether you qualify for a federal subsidy. They call it advanced premium tax credit. And about 98, 99% of Mississippians qualified for a subsidy. That meant that they, in some cases, they paid as little as $0 for their insurance policy. So when you go through the process, they're going to analyze all your information. They're going to make a determination, and you see what you qualify for. There's a set premium, and if you qualify based upon your household income, and one way to look at that is your household is based upon what you file on your federal income taxes, and we determine if you're going to qualify for that subsidy. And most people do. $0, $25, $50, very affordable, so that they can get covered. But once again, we're not insurance brokers. We don't work for the insurance companies. We are funded by the federal government to provide this assistance to you. All right. Good morning, Lucille Green from our Team Jackson, one of our newest navigators. All right. Thank you for checking in. And we're excited about Team Jackson, that they're in our headquarters location. So we're excited about that. And we're excited about, oh yes, we got the post going now on our Get Covered Mississippi site. So we're excited about that as well. All right, there we go. All right. Again, if you need assistance, you can call us at 662-298-3584. 662-298-3584. That's in the state of Mississippi. Even if you've gone through, if you look, may I just lay it out to you? We know in the past, some folks have gone through the process of applying for the Affordable Care Act, and the premiums were not just affordable for them. All right, but because of the Biden administration, American Rescue Plan, the subsidies have increased. And so we went through the special enrollment period this past summer, winter, spring, and summer. We had so many people who had come through before who didn't want to give it a shot. They didn't want to try it. It said it was too expensive. Y'all, they came back through, and these same people were happy that they got affordable coverage. We had I've heard examples of people who before their premium may have been over $1,000 because of how things were set up. But now with the better subsidies, they came back and they were talking about $25, $50, some even $0 premiums. So look, what do you have to lose? We're working with you. We don't charge you anything. Come in, get the information. You can see what kind of coverage you have. All right. What are some of the people? I know I get this question. What are some of the people that may benefit from the Affordable Care Act? Well, you know what? One of the growing groups that we have are the people who are thinking about retiring, that 60 to 65 age group. And they're saying, well, you know, I got enough years in and all this, but man, if I retire, what about my health coverage? I'm not old enough yet to qualify for Medicare. And so they come to us and they say, wow, you know, if I leave the job now, my premium is going to be basically almost like Cobra. That's going to be just astronomical. And they come to us and they look at what their income is going to be on their pension. We work with them. And in many cases, we're able to work with them so they can get coverage through the ACA. All right. They can retire, they're on their pension, and it works for them, and they can start enjoying their golden years. They're sitting back in the rocking chair, you know, a few years sooner. So that has been a group that we have really worked. Matter of fact, one of the first people that we enrolled was a couple back in 2013. They were the wife worked at Walmart, and the husband was already retired, and they wanted to start traveling, but she was working at Walmart because of the health insurance. They came to us and they said that they just bought one of these big old, you know, Winnebago, what do you call them things, the big travel van things. They're going to go across the country. And the only thing that was keeping them from really going, having the dream come through, was health insurance. And they came through, they worked with us. We got them covered. She quit her job. I think literally the same day they got covered. She quit a job. All right. And they jumped in and they started going across the country. And I thought that was so great because, again, they had worked all of their lives and and they wanted to enjoy it. They wanted to see the country. I think their goal was to visit all the different states. But the only thing that was holding them up is that she had to keep on working for her health insurance. But because the Affordable Care Act, she was able to get, they were able to get coverage. And that was back in 2013. I don't know. Obviously, we've lost track of them since then. And I hope that they enjoyed themselves. But that was one of the benefits of the Affordable Care Act for them. They were able to get coverage, good coverage, and they were able to start enjoying their retirement. Wow, that's wonderful. That's wonderful. Okay, another question. Look, we're not going to be going continuous. I know somebody asked. We're not going to be going continuously from now until, I guess, 7 p.m. We're going to be logging off probably about 10 o'clock for this first section, and we'll be logging on back at noon, but it'll be the same link. It'll be the same link. So the link you logged in now, you'll use again. All right. And on our webpage, see behind me, getcoveredms.org. We have some other resources. You can click there and look. And working with our federally qualified community health centers across Mississippi, you can download a document that has the phone number, name by county of those that can assist you. Look, Mississippi is blessed to have one of the best networks of federally qualified community health centers there are, and network there is. And we're also home of the first federally qualified community health center in Mount Bayou. And I want you to know that they want you to get covered too, because what ends up happening, folks that don't have insurance end up at the doorstep of our community health centers. And it works out better for them if you have coverage, because therefore they can go ahead and submit a claim. And that way it can help subsidize other folks who just don't qualify for coverage. Okay, I know here comes the question. Well, what about those people who fall in the coverage gap? All right. Okay, so the people who fall in the coverage gap. I know Mississippi did not expand Medicaid, which meant on the Affordable Care Act that people who don't have children, just single people, low income, would be able to get coverage. Now, the Affordable Care Act, when the law was passed, it was on the assumption that people that had little or no income would be covered by Medicaid. The Affordable Care Act was never meant to cover people that fall in that lowest income category. And we call that the coverage gap. And even though they made some changes with the American Rescue Plan, that coverage gap still exists, because in the state of Mississippi, we do not have the enhanced or extended Medicaid. So what do? You go through this process, you need insurance, your income is limited, and everything else. What do? Well, what we will say to you is that we're going to refer you to one of the federally qualified community health centers. Now, this is not free coverage. It's done on a sliding scale. But we do want you to go through the process. You know, sometimes there may be extenuating circumstances because of your health conditions that you may qualify through the state for some assistance or through the federal government. We want to go through that process. But if all else fails and you fall into that coverage gap and you're not able to qualify for one of these subsidies, then we would refer you to one of the many federally qualified community health centers across the state. You all know something that's amazing to me. What's amazing is I still, today, we have people and they're really almost in tears and upset because they don't qualify for a subsidy on the ACA. But then we tell them, say, well, look, do you know there's a community health center 1 mile from your home? Now, look, the person has been living in this community all their lives. The community health center has been there 20 years or something. And they did not even know that literally in walking distance, there's a place they can go and to connect with a health professional. So that's what we would do. That's why, look, I'm thankful for my mom. She has coverage, but she goes to the federally qualified community health center there in Coldwater and everything. And but she has the Medicare, and she also has other coverage. But she goes there because she has insurance, and she knows that when she goes there and her services are covered, that's literally helping subsidize other folks who fall in this coverage gap. Look, y'all, just because it's a community health center, that does not mean that that is inferior care. Matter of fact, there are quality people there, quality doctors, quality nurse practitioners. There are people there who know what they're doing. They connect you to specialists. And in many of our communities, the community health center is the place to go for your health needs. So instead of some folks driving 20, 30 miles to go somewhere, you got a community health center right there can take care of you. And if you're covered by a private insurance, Medicare, or something else, guess what ends up happening? You're literally helping subsidize for those people who fall in that coverage gap. All right? Because look, the community health centers do all they can to be supportive, but at the end of the day, they are businesses and they have to find ways to generate income. So when you come in and do that, that's a big help to them. All right? All right. Okay. Now, the other thing that people are asking, they're asking about the CHIP and Medicaid if you qualify. Well, in Mississippi, it's not computer-based, it's paper-based, okay, for the most part. It's an application process. So if you contact us, 662-298-3584, we will connect you with one of our sisters from Healthy Kids Mississippi, and we can walk you through that process. Because even you go through healthcare.gov and it says you may qualify for Medicaid or your children for the Children's Health Insurance Program, it still is a separate process you have to go through to apply. We'll work with you on seeing how we get that done. We have some great assistants, some application administrators who will work with you in getting your application done. All right, so we'll start you with the healthcare.gov. We'll start you with Get Covered Mississippi. We'll slide you over to Healthy Kids Mississippi, walk you through the process, and submit your application to them and see how that works and getting your coverage. And what we've discovered is that many times people just don't want, just the application, the process just seem just challenging and everything else. But I'm telling you, our sisters, our application administrators, they'll work with you. Now, we know we're in this pandemic and we have to do curbside service, or we have to do things with remote consent on those things because we have to be careful in this pandemic environment. But we are able to work with you to get that done. Now, I want you to know that our application administrators have been working, getting applications submitted, going through the process with the state, getting them verified. It has been great. So we can go through, work with you, and get that done. So what that is saying is that we can work with you wherever you are. We can work with you if you fall in the coverage gap. We can work with you to get your Medicaid and the Children's Health Insurance Program. We can work with you on getting yourself set up through healthcare.gov. Also, we've done some referrals for some veterans who then realize they qualify for some VA benefits. There's always something there for the VA they may because if you serve at least one day on active duty, there are some possibilities for you. So we've done that. Even still get some folks for Medicare. For whatever reasons, they don't get the fact that they are covered. So we're here to help you. Get Covered Mississippi. Get Covered Mississippi. Get Covered Mississippi. Today is the day. We're kicking off. It's our open enrollment 2022. I have been doing this since 2013. Wow. And I do it every year. And I'm just excited this year as I was way back then. So I'm continuing to be excited. I want you to be excited about it. This is a great opportunity. The subsidies that they have now are the biggest they've ever been. Again, we've had people that come in past years and whatnot who did not have, they just were two, and they come in and they're getting a very low premiums. That's been great. Look, we're excited also that our project director, Lonnie Miner, has joined us today. All right. And all right, so we can see how this camera works.
Good morning, everybody. Good morning. Good morning. Welcome. So glad you're here. All right, Get Covered Mississippi. One of the questions we get a lot is, what is this? Is this Obamacare? Yes, it is. You know, that used to be a negative connotation back in 2013 and 2014. If somebody said Obamacare, they meant it in a bad way. Now we know that this program is sustainable and that it is wonderful and that it helps people. You'll hear it, the word Obamacare used. You'll hear people say marketplace coverage. Folks will say ACA. They'll say Affordable Care Act. All those words mean the same thing. And we want people to just visit Get Covered Mississippi virtually or in person or online or however to get more information. Whichever name you call it by, it is the same product. All right. And this is our kickoff, just reminding everybody. Dr. Minor, I see a question in the chat. Have you already done the chat questions? You have? Yes.
Yes.
All right, cool. Hello again, everybody. Good morning. Good morning. Good morning. Website. Remember our website, www.getcoveredms.org. Headquarters phone number 662-298-3584. And we have over 50 navigators, 51 or 52 actually across the state who are ready to assist. Zero cost to the consumer. Zero cost to the consumer.
All right, that's our project director, Lottie Minor. She's excited about today, about what we got going. We're here to assist you. All right, again, we're on also on social media. We're on Facebook. We're on YouTube. Also, we have some other questions. Okay, look, we want to respond to these questions. Okay, now look, we do not represent Ambetter, Molina, or Cigna. We just mentioned the fact that those are the three insurers from Mississippi. We are independent. We are not insurance brokers. We are the federal government. If you got a grant from the federal government for us to provide assistance. All right, we're not biased with any one of them. Okay, impartial. Okay. All right. When you come to us, we're not going to come and say, look, these are the three plans, the three companies, pick one of these plans. No, what we're going to do is get the information, go through the application process, and then it will see if you qualify for a subsidy, and it will give you a number of plans. And when you look at those plans, the key thing, everybody, look, let me give you a couple examples to help you on this. All right, so you may get a plan that, wow, the premier thing is great, but then you look at it and your doctor is not included in that list of doctors. So maybe you might get a plan that's slightly higher just to cover your doctor included. Then it may be a medication that you have, and your medication that you have is not covered on the formulary. So in addition to looking at what the premium and everything is, you want to make sure your doctors and your medications are covered in these plans.
And another thing that we looked at down in other parts of the state, you want to look at the proximity to the doctor's office. Back in the years where there was only one or two insurers in the state of Mississippi, people had to drive a long way to get to the doctor that would accept the insurance that was available in their county. Now, obviously, it's not as bad now because all three insurers are in the state. However, there's a lot of things for the consumer to look at. What we want folks to do is make the right decision based on their needs. So what do we call? We're navigators. So we help people navigate the process. We don't help them. We don't make the decision for them.
No. If you come,
we don't make the decision.
No, we don't. Again, we just simply saying these are the three companies. We don't work for them. We're not telling you to get in one of them. We can go through the process and you work with one. And again, when you come to us, if you got, I've had people come with their list of medications, literally their list of medications, and they've gone through and they looked at the formulary and whatnot. And one year, a person had like a choice between like a zero deductible. I think another was like $50. But when they ended up with the one with $50 because it actually included the the doctor and the medication. So you want to go through, have that, and make an informed decision. Okay. All right. Another thing that's popped up that's from social media. When does coverage start? Okay. If you enroll today, your coverage, you pay your first premium, your coverage will start on by January 1st, 2022. That's when your coverage will start. That's when your coverage start. All right. And then that's as if you register, if you enroll between today and December 15th. If you enroll December 16th to January 15th, your coverage will start on February 1st. So if you want your coverage to start the first of the year, you need to enroll between today and December 15th. That's when the coverage will start. Okay. All right. So people asked about that they live on the borders, like we're up in the Memphis area, some folks down there in New Orleans area and other places. What about doctors out of state? Again, go and when you look at get the coverage, you look at your the list of doctors and everything, and they'll let you know. In many cases, yes, that is definitely works when they're across that, where those networks are. Again, go back, look at the networks, see what those things are. Matter of fact, what some people even do, they call their doctor's office, or they call their community health center, whatever the case may be, and they say, look, I'm thinking about getting coverage, and this is the plan. Do you accept this insurance? So we've seen that happen, so that people will be covered. Okay. Also, we want to give a couple other updates here. Is that people are concerned about being self-employed. We probably hear more about this from our team down the Gulf Coast. Yeah, if you're self-employed, you still can get covered. What you have to do is make an estimation. Either you're going to use what you did on your last year's taxes or what you expect to make for this year, and to make and use that as your income level. And once you go through that process, you can see whether you qualify for a subsidy or not. Again, go through the process. I can't say it enough. Just go through the process. Go through the process. I always tell people it's not going to cost you anything. I know a little bit of time, but we're the one working with you to get that done. You go through the process, you may be surprised at the end, because again, the subsidies have increased. And where in the past it may not have been affordable, now it is. You can do that. All right. And again, we are covered. We have coverage. We have navigators all across the state of Mississippi. All across the state of Mississippi. And when you contact us, even though many of our sites now are following these protocols because of COVID-19, they can set an appointment with you. They got curbside service. They have some have limited face-to-face contact. Some of the things can be done remotely. So wherever you are in the state of Mississippi, any one of the 82 counties, contact us. Call us today, 662-298-3584, 662-298-3584. We want to talk to you. We want to see what we can do to assist you. We want you to get covered, Mississippi. We're excited about one of our prime collaborators who's been with us from the beginning, Aaron E. Henry, Community Health Services Center. They're located in Clarksdale. They have really were great in the work that we have been doing. And when I know we first got started on this journey and everything, I want to thank to Miss Aria Jones Taylor, who the executive director there, and she really worked with us early on and got us connected with the community health centers across the country. And we give a shout out to Lakedra Giles, who's our point person there, who's been just sharing information and making sure that we stay connected to all the wonderful certified application counselors all across the state. We're so excited for the work that they do. You know, we hear so much about the navigators, but our community health center has some fabulous certified application counselors who are there, ready, willing, and able to assist you. When you call us at 662-298-3584, or you download that list from our website with it, it's got for every county. You can make a phone call. They're there to assist you. And look, it goes back and forth. They come in and we find out that you are on the Medicaid or Children's Health Insurance Program. They can refer right back to us. We got some powerful, wonderful Medicaid CHIP application administrators that'll walk through the process of getting it done. Also assist you with the renewal. So we thank Ms. Dennis Taylor and the Aaron E. Henry Community Health Services Center for their support from 2013 even up to now. Also, I want to give a shout out to Bo People SOS Gulf Coast, Danny Lee and his team down there in the Vietnamese community. They have been great in our connections there in the coast, along with Mercy Housing and Human Development. Julie Egressy is the executive director. They have been with us from the start. To collectively, the Gulf Coast, Biloxi, and all down those areas, all along those counties, right across those you go down across the coast, Gulfport, from all the way from one end, from the west end to the east end, we have navigators there that are ready to help you. We have bilingual navigators that can really work with you from the Vietnamese community, in the fishing industry down there, a lot of self-employed. We're here to work with you to get that done. We have been working with the Vietnamese community there on the Gulf Coast since we got started in 2013. We made a special effort to be supportive of their work. We hear so many wonderful things from those who are in the fishing industry who say without this Affordable Care Act, that they would not be able to keep doing the work that they're doing. They would have to get a job. So we're excited about that relationship. And again, Bo People, SOS, and Mercy Housing and Human Development, we're excited about the partnership that we have with them. Also, Catch Kids Tupelo, we have been working with them since we got started. So Carol Black is the executive director there, and we're thankful for the work that we can to continue to do with them. But particular Valerie Long, who is their navigator for Catch Kids, that's in the Tupelo, Northeast Mississippi area. You give us a call at the office, we can connect you over there. And we'll also start doing some work with some of the Head Start centers with the through our Healthy Kids Mississippi initiative. So if you're over in the Northeast Mississippi, Tupelo area, Lee County, any of those places over there, Tishomingo, you want to give a shout out to us, we'll make that connection. But again, Catch Kids, Tupelo, Valerie Long, and who's a very fabulous nurse practitioner, wonderful person, will do anything she can to assist you. We're just blessed by having that relationship that we've had. So for them. Also, we want to have a lift out to Mid-South Churches Cooperative Conference, Baptist State Convention. Their Vice President at Large, Pastor Bernard Montgomery, he's already excited for the noon part of this telethon, that he'll be sharing some things in his team. Loretta Miller, Kathy Garrett, Philistine Albright, Ethel Hill, they're excited too about the work they're gonna be doing in working with the faith community, the churches, getting them excited, getting them pumped up to get them rolling. Oh, wait a minute, let me back up. I didn't realize we have Gabby Brown. Hey, good morning, Gabby. Gabby Brown from Mercy Housing and Human Development. We'll be going down the Gulf Coast this afternoon at 3 p.m. I didn't see that, so well, pardon me, Gabby, for not record. So Gabby from Mercy Housing and Human Development is on with us, and we do have some folks here from Mid-South Churches already getting warmed up for noon. Sister Albright, Sister Garrett, as we say in the good old church land. All right. And we're pumped up to see one of our fabulous application administrators for Healthy Kids Mississippi, Medicaid and CHIP, Pat Boga. She's on this morning. And so we got a good assembly early on on a Monday morning. All right. And of course, our location, we're co-headquartered, Get Covered Mississippi, Oak Hill Regional CDC at the Hill Hernando Baptist Church. And that's at 1775 Memphis Street, 1775 Memphis Street in Hernando. That's our headquarters location. And because of how the sign ordinances and things, we don't have a sign out there that says Get Covered Mississippi, Oak Hill Regional CDC. It says the Hill Hernando Baptist Church. But guess what? When you come up, you got your GPS and you put in 1775 Memphis Street, you come in and see it. It's a converted warehouse. It's looking real good. We got things lined up there for you, and we can come and assist you. But we do suggest it wherever you want to go to give a call, 662-298-3584, 662-298-3584, and set an appointment. We come, get things set up with you, see what things are. We also, if you need the language assistance, we have connections. I know for our Spanish speaking community, we have connections so that we can get you bilingual translation so that you can be able to get assistance that you need. Again, this is not Medicare open enrollment. This is the Affordable Care Act, Obamacare. We know Medicare enrollment is also going at the same time. We will refer you to Medicare.gov or to the state's senior assistance program for that information. All right. Look, we want you just to come in, call something, check in with us so that we can assist you. Again, if you join us late, my name is Michael Miner. I'm the executive director of Oak Hill Regional Community Development Corporation and of Get Covered Mississippi. We are on Zoom. We're restreaming. Wow, I didn't look at the numbers from a little while ago, but wow, look at those numbers, man. We across about 10 different platforms. We are broadcasting today, and there's just a wow. This is early in the morning. It's just unbelievable the number of people early in the morning who are watching us across social media. You know, it's great when you can do the Zoom piece. A lot of folks don't do Zoom. They don't log in, but they're clicking on Facebook and on YouTube. So we're thankful for all you all. Again, we've seen some of the questions. Those we missed, we'll get at noon, 3 or 6 p.m. All right. Again, nearly all of Mississippians that have enrolled in the ACA have qualified for an advanced premium tax credit. All right. And so once you come in to apply, I want you to apply. I want you to come in and start working with. Don't wait till the last minute. You want to come in and do that. And also, once you get coverage, this is the real McCoy. This is health insurance. Once you get it and you get covered, you want to use your insurance. And one thing I love about the ACA, your preventive care services are no charge. We just got finished with Breast Cancer Awareness Month. So women, your mammograms would be covered. This is now American Diabetes Awareness Month, and some of the things which much supplies and stuff would be covered under the ACA. So we not only want you to get covered, we want you to stay covered. Once you get the coverage, you want to go ahead and to use it. Get you a doctor, or as I say, your health professional, because I know we have a lot of great, fabulous nurse practitioners who are able to assist you in the work that you have. Thousands of Mississippians have been covered. I got the latest numbers here. All right, thousands of Mississippians have been covered even the last year. So 111,000 people across the state of Mississippi enrolled, been enrolled currently, 111,000 people. And that was just before we even had this other open enrollment period. So if you know somebody that's not covered, they don't have insurance, they've been thinking about it, maybe you are a grandparent and you got some grandchildren that you know need covered, you can reach out to them. If they're over 26 years old, they can come in and we can work with them to get them coverage. The ACA children can stay on their parents' insurance coverage until they turn 26. Ministers, pastors, some churches out there. Churches, you can, if you're a pastor, may not qualify for the advanced premium tax credit. With churches, you can come and you can pay the premiums for your pastor. We've had a number of pastors down through the years. They've come in, or the churches have come in, and they've gone through the process, and the churches have put in their budget and they pay for it. And everybody's happy because we have some pastors that want to step down and to do full-time ministry work. And one of the issues had been health coverage. So what they've done is they work with their church to go through the ACA to get covered. Wow, wonderful. They're happy in the coverage that they're able to obtain and everything. All right. So look, we're just going to a few more minutes more. We're going to do another scan. But again, we're going to come back on again at noon. Mid-South Churches, Faith Community 3, the Gulf Coast, Golden Triangle, others 6 p.m. Our team Head Start. You can go to healthcare.gov right now. Well, look, we have a lot of people who start out on healthcare.gov. They have some questions, they get tripped up on something. They call us. But remember, when you go through there, don't forget to put in our navigator ID number. We want to get credit for the work. We're not charging you anything, but we are assessed the number. We are, I want to say, we're tracked. We have a track about the number of people that we enroll. And so we want to make sure that we see that, and you put our navigator ID in. When we talk to you, we can talk to you in general terms, but once we get to a point where we have to ask you or get involved with some of your income information, your personal identifiable information, we're going to get you to sign a consent form. And that's just to protect us all. To let you know that we can share some information and whatnot. And once we get that consent form signed, we'll go through and we'll get some the information that we can complete the application process. But just to answer general questions about the ACA or general directions, let us know there won't be an issue. We got some additional brochures and flyers on our website that you can have, you can share. We're calling on, and they'll send more about that at noon on all our churches to do shout outs about it, our nonprofit groups. November 1st, y'all, it's open enrollment. Yes, I'm excited. I already said that, didn't I? I'm excited. Open enrollment. November 1st, it started. It's come back again. The ACA Obamacare kickoff telethon. We're just excited about you all being with us. Get Covered Mississippi, a network all across the state of Mississippi, 82 counties. We have a lot of folks that are just ready to assist you. Not only our navigators, but we got certified application counselors, navigators that are work with Oak Hill Regional CDC, and our certified application counselors that work with all the fabulous community health centers across the state. They're here to help you. That's their job. They're not only here to help you, they want to help you. We have a big presence now in Jackson, our state capital. We're just excited about that, not only with our community health centers, with our certified application counselors, our CACs, but we also have 2 new navigators there working in our headquarters and our statewide, our state capital headquarters, there to assist you. The Jackson area is huge. It's the largest metro area located inside the state. But just give us a call. We'll connect you down there in Jackson, the Jackson metro area, there to assist you. All the churches, the fraternal groups, the fraternities, sororities. Everybody's all excited now down at JSU because of Coach Dion down there in Jackson. All the excitement. Well, that's good. I'm excited that we got a strong crew down there in Jackson now to assist you. We got some folks that can help you. Anybody in the Jackson metro area, just call us and we'll connect you. We got some folks that we just brought in. They've been trained and they're excited and raring to go to get some information, to work with you to get this done. So the Jackson metro area, our largest metro area, we have a strong team down there in our state capital to assist you. If you call, we'll connect you. Okay. Over in East Central Mississippi, we're excited about the work that we're doing there. Meridian, Lauderdale County, over in the area along the Alabama-Mississippi state line. We got some folks there that can assist you. Yes, they can work with you. That if you just make a call, we can do that. Down in Macomb, down below Jackson there in Macomb, we have a great group of sisters that are able to assist you in the southwest part of the state of Mississippi. We've added some more people onto the team there. They're ready, willing, able to do that and get that done. We're just excited about what they can do. I've been saying a whole lot about being excited. I'm excited about it. So look, just give us a call. Look, some of you all is early and some folks, want to know about. So maybe there's some other questions. Come back on at noontime and we can do those and the fill in the question we have. We're gonna be doing this kickoff telethon all day long at 9, noon, 3, and 6. The same link. You can just go in and log in. We get it done. We're filling questions. If we missed your question this go round, we'll come in and we'll get it done. We want you to get covered, Mississippi. We don't want anybody not to have coverage. And look, as we wrap up, again, we know some folks gonna fall in the coverage gap. We know some folks are not gonna qualify for the subsidies, but aren't we glad for all of the wonderful federally qualified community health centers in the state of Mississippi that provide the catch-all to be able to ensure that anyone that needs coverage in the state of Mississippi's got a place to go. Now, with that being said, some of you folks with coverage, you ought to make the community health center your primary care provider. See, that way, your insurance will help subsidize for those folks who don't have it. And I'm telling you again, some of the best doctors, some of the best nurse practitioners, some of the best nurses, some of the best folks in the medical profession work at our federally qualified community health centers. And we have the best network of community health centers in the country in Mississippi. Now, if you don't believe me, you just need to go in and check it out and you'll see what I'm talking about. All right. Okay. Look, before we go, shout out to Dr. Lucille Green. And she is a Cancer Society survivor. So shout out there to Dr. Green. All right. Just after breast cancer awareness. And also Dr. Green is one of our new navigators who'll be working real strong down there in Jackson. And hopefully we'll hear from them in our 3 o'clock hour. But we're glad to have her on and be a part of what we're doing and part of the excitement. I told you we got a strong team down there in Jackson, in Metro Jackson. Look, if you don't believe it, call today, 662-298-3584, 662-298-3584. I'm going to say it one more time, 662-298-3584. And we're going to kick off the thing. We're going to get excited today. Open enrollment 2022, open enrollment 9, the Affordable Care Act, healthcare.gov, get covered Mississippi, get covered Mississippi. All right, look, we're going to sign off now so that we can get all ready. All right, Joyce Nunn. Yes, okay, Joyce, she's excited. Go ahead, Joyce. We get ready to sign off, but we're going to come back on. We'll see you at noon. Well, you see, it may not be me, but it's another part of our team at noon for Mid-South churches who are going to get us all pumped up for our faith community and everything that we have. All right, we're getting ready to sign off from our social media. We will hang out for a few minutes here on Zoom for anybody have other questions. But we do thank unbelievable numbers. It's just unbelievable the number of people. I'm looking at it now on Facebook and YouTube this early in the month. Thank you so much for joining us. Look, tag somebody and tell them that we'll do all again at noon. Look, thank you. And remember,